professional image. Professional image. Look at the nursing then in the 1960s during the era of Florence Nightingale. Can we see how the uniform is? And look at the nurses now in the 21st century. Sometimes we find out that there are so many changes that we are afraid to embrace. But if at all we want to move forward, we must embrace such changes. We said now nursing has been defined by International Council of Nurses, by American Nurses Association, by Canadian Nurses Association, by Florence Nightingale, and by Virginia Henderson. All that they are talking about in their definition is patient safety. Patient safety. That is all they are after. We said, who is a nurse? Just like I said, I want us to refresh our memories. A registered nurse is a nurse who has graduated from a nursing program and met the requirement outlined by the country, state, province, or similar licensing body to obtain a nursing license. That is a nurse. Now, let's look at the definition by the Nursing and Midwifery Council of Nigeria. They said a nurse is a person who has received authorized education. Praise be to Allah that the Department of the Directorate of Nursing Services together with the NAM, Kebbi State Council, have been able to close a kind of quack nurses training facility at Jega yesterday. Now, we said who has received authorized education, you must go to a nursing council accredited training institution, acquire basic nursing or midwifery training. You must sit for the final qualifying examination. You must pass the final qualifying examination. You must apply for the registration and licensure. You must be registered. You must be licensed before you can call yourself a professional nurse. Said a nurse must be sympathetic. There is a question mark attached to the sympathy, but he must be empathetic. They said sympathy. A patient came involved in road traffic accident, for instance, with multiple fractures, bleeding profusely. The patient relative is crying. You sit down together with the patient relative and you begin to cry. Is that not the sympathy? Yes. That is the sympathy. That means sympathy should not be there as part of the qualities of a nurse, but rather empathy. You have to place yourself on the shoes of the patient or the patient relative. Okay? You must be sensible, tolerant, obedient, morally good. The issue of tolerance is something questionable in nursing profession these days. The issue of obedience is something questionable in nursing profession these days. As far as nursing is concerned, even if someone is ahead of you in nursing education and training, with 6 months, he is your senior. He is your senior. You have to respect such individual. No matter how you are going to interact. You go outside, you interact on personal ground. It's different with when you come inside the hospital, you are taking care of the patient. That respect must be there. Even if it is your sister or your brother. We said economical. Economical, not with your resources, because nurses are not wealthy. Not with your resources, but with the resources of the patient. You have to try as much as possible to economize the patient resources. You have to be faithful. You have to be punctual, truthful. All this, whatever you tell patient now, when he comes tomorrow, let the statement be the same. Observant, neat and tidy, uniform. You see a nurse in uniform, white, up and down, but wearing sandals. As far as uniform is concerned, you are not in uniform. Okay, ethical principles, briefly, we said respect for human dignity. Human dignity and respect for persons are the foundation of the 6 ethical principles. Okay, we said beneficence is the duty to do good for the client assigned to the nurse's care. You must do good to your patients. It's under must, it's your obligation, it's what you are employed to do. you have no choice. You must do good to the patient, regardless of the differences between yourself and the patient. Of either tribe or the patient is your rival, on personal ground outside the hospital. Once you have entered, he is entrusted under your care. All those personal issues should be kept aside. Take care of the patient as the patient. Non-maleficence means to refrain from doing harm. Non-maleficence is the principle that obliges us not to inflict harm intentionally or unintentionally to the patient. Autonomy refers to a client's right to self-determination or the freedom to make choices without opposition. When patient or client is making choice, you don't force him and you don't push him under coercion. Allow him to make his own choice under his will, and you must obey his choice. Remember the right of patients. Patient Bill of Rights. We say the patient has a right to accept your care. At the same time, he has a right to what? To reject your care. So if he has rejected your care, you have to apply the knowledge you obtain from behavioral science, psychology, to make patient and convince him to accept that care. Sometimes, as a nurse, you need to ask yourself this question. The way I am taking care of my patients under my care, is that the same way I want nurses to take care of me when I fall sick? It's a question that you need to ask yourself. If the answer to this question is yes, wherever you are a good nurse and you are a proud nurse. But if the answer is no, definitely you have a long way to go. Okay? Veracity is the duty to tell the truth. The nurse must provide factual information to the client so that he or she may exercise autonomy. Confidentiality means that information entrusted to professionals in the line of duty should not be revealed to others. A patient is diagnosed HIV positive. You go back to your majalisa. You sit down, even those your friends who are not nurses, but because she lives in that area, as she is passing by, you are telling them, you see that lady, she is HIV positive. I am sorry with your career as a nurse. Sometimes, as also a newly qualified nurse, you must mind your utterances, how you address your senior colleague. You cannot just come and show him that you know something better than him, but try to call him to order. Ma, sir, these days we are taught in school that this particular practice should not be done like that. This is how it should be done, in a more polite manner. We said non-participation in making policy. We have major problem in this issue. Some months back, we lay our hands on some documents of task shifting. Mr. Chairman will bear me witness and task sharing policy in Kebbi State. And if you see the kind of procedures that are shifted from nurses to physicians, you will shed tears. But very unfortunate, nurses are part of the committee who sat down to come out with that policy. I am very sorry to say if Mr. Chairman is not happy, but it's a bitter truth that we must tell ourselves. It's a bitter truth. You must engage in policy making. If you are called as a unit charge to attend a meeting, you cannot be able to make it. Assign somebody in that unit to go and represent you wherever that meeting is going to hold. Let him have the information. Let him come back and share the information to you. Because they say information is power. Sometimes my students will tell me that I come to hospital. Most of the nurses, they will tell me, wallahi, we don't have time to fill this questionnaire. But my brothers and sisters, don't forget where you have come from. You pass through the same process, and you don't want others to pass through the same process. You must engage in research. You must prepare a questionnaire, and that questionnaire must be delivered to the participant. And those participants must respond to that questionnaire. And that researcher must take the responses and analyze as data before he can come up with conclusion and recommendation in his research. If he is targeting nurses, you say you are not going to answer that questionnaire. Now, who do you want to answer that questionnaire? You don't have time, we know, but take out of your little time. go through the questionnaire. Most of the questionnaires that are designed these days, you don't have to write anything. You just have to tick. Just tick and go. Just tick and go and deliver the questionnaires back to them. Copy. This is something we have talked about earlier on. For the fact that we are here now, that does not mean we shall remain to be here in Sahaya. In the next few months or few years, we may be posted to some general hospitals. Wherever you find yourself, if you are teaching those choose and they choose, your nursing responsibilities, you are promoting quality. They come, you say, okay, you are busy. Or sometimes you have ceremonial activities to attend to, either on Saturday or on Friday. Okay, she is a Chu or J2. Please come and take over the work on my behalf. You teach her so many of nursing procedures. The next time, she will say that she is a nurse. Whatever harm or injury she has inflicted to a patient, remember, she is telling the recipient of that care that she is a nurse. They will address her as a nurse, and therefore, the image of nursing is dealt with significantly already. If you cannot do, there is something they call local arrangement. I don't like it. I don't like it personally. But if that is the only thing you can do, try to do it. He is a nurse on night shift. You are going to be on evening shift in the next coming weeks. Prepare ahead of it. Take over from him. Let the in charge be aware. Cover his shift so that when the time comes for your shift, he should be the one to cover. That one is local arrangement, but to some extent is nurse versus nurse. In conclusion, you may see it as just few statements, right? Nursing, what it is and what it is not. I quote the very first book published by the mother of the modern day nursing, Florence Nightingale, in the 1960s. She named the book Nursing, what it is then and what it is not. That means there are so many things that are not part of nursing, and there are so many things that are part of nursing. And I am very happy.
Thank you for a wonderful presentation. My question is based on care given for that before the patient is taken probably for a surgical procedure. I want to know if after the preparations that are being made, like the physical, the psychological, all those you mentioned, I think in cases where maybe like in the labor room, I should use where I worked, the issue of shaving, I want to know, is it supposed to be done by the nurses in the ward or inside the theater? Because sometimes you have a situation whereby you are trying to shave the patient. Maybe somehow the patient is being injured, and then the process of taking that patient from the ward to the theater, anything must have happened, infection or something. That was one. And then secondly, for the issue of confidentiality, we talked about the nursing profession. When you talk about that, like when you made that illustration of a patient that is HIV positive, I want to know, because if we want to be sincere with ourselves, we know naturally some of us are careless. Nurses, some of us are careless. Okay, in a situation whereby you have a patient in the ward that is probably maybe HIV positive or hepatitis patient, and then you are handing over to the next nurse. Maybe I'm on morning shift now, I'm supposed to hand over to the evening shift, and to the evening shift nurse. And this patient was admitted in the morning. And this other nurse that is coming into the ward doesn't have an idea about it. Normally you hand over to your colleague, this is this and this is that. Some of them might be careless and probably play with maybe injections or something of that particular patient. Are you trying to say it's out of place to tell this patient, to tell your colleague that, okay, this patient is hepatitis positive, you have to be careful? Please, I want to know. Thank you.
Thank you very much, the presenter. You are really done justice to the presentation. Ideally, I really want you to, my own is not just question, but as you have started the issue on the community nursing, please can you just a little bit elaborate, brief and concise, so that people have an idea of what it means. Thank you very much.
that is the issue of confidentiality in patient care. When you are handing over, you have to hand over very well to the next nurse who is going to take over from you, including the diagnosis of the patient, because that nurse is going to participate in the care of that patient. Because you work in the same ward, he is going to take over from you. You are not expected to hide anything that you know may further inflict injury either to the patient or to the nurse himself during the handing over process. Tell him everything. He is part of the care of that patient. On the issue of who is to convey the patient to the theater, I think I have mentioned a porter during my presentation. We are talking about whatever we are to talk about, we have to talk about what is ideal. And we also consider what is feasible in our setting. Ideally, there should be a porter. You go, you sign the checklist, and you hand over the patient to the porter, and it's the porter that will convey the patient to the theater. When we talk about consent form, there are so many procedures that a patient will undergo, that a consent, obtained consent. When we just say consent, what we used to have now is just consent form. When we say before, signed consent form, now we used to say obtain an informed consent. Obtain an informed consent. That is what we used to say now. Now, for you to obtain an informed consent, if there is a provision for you where you are going to sign, that means either you countersign after the physician has signed, you sign as a witness that yes, the information has been delivered to the patient. The patient has understood and is willing to undergo the surgery. Issue of community nursing, sir. I think at this point also I would like to hand over the microphone to the chairman.
On the issue of community nursing, I'm moved and I'm touched when I read a lot of social media criticism to the Humble Register. We are not doing justice to ourselves. It is a common adage. A younger generation who fails to go and learn from history are bound to make a mistake. We don't move closer to our elders. When issues like this come, you run to them and they'll tell you the history. What brought about the issue of GQ and JQ in Nigeria today are this: because of lack of due consultation, spreading of half information. Challenge. When we have community nursing and community midwifery, the essence is to have a kind of services to the doorstep of our people at the community point. And who will be the regulatory body? Nursing and Midwifery Council will be regulating them. And they are solidly answerable to nurses and midwives. That is the brief overview in Nigeria. Now coming back to the local context. Just like what he has said during his presentation, we should not always be a consumer of policy. We should be part of policymakers. And this is part of what we are advocating. And he can bear me witness. At any time, even in the midnight, I do call him for consultation. How do we go about something? And this is what we have made. How do we go about it? Yes?
So, before I should leave this, I would like to leave now because I have some other things to do. May I say, or can I ask the presenter, the planners of this presentation? You have done a very good job, but I will leave an assignment for you. So please try and note the challenges before, during, and after, and where you feel the management will come in. So I'm all out to assist the situation. Thank you very much.
A nurse is a nurse, whether you like it or not. And the truth must be told. You should face it squarely. Know yourself and know what you are doing. Don't allow anybody to push you. Do what is right, and that's when you stand on that policy. Of course, it's normal, you must confront challenges. You don't expect life to go so easy. It's not possible. It will never happen that way. You must cross challenges. Don't allow challenges to push you. Continue pushing that challenges, and you arrive somewhere. And I think the nursing profession we are moving forward now. And I really appreciate the effort of the management and the NAM, and the chairman of Sahara branch for organizing this. And I think we are moving forward. So let's express it here. support them. Let's support the management and the NAM chairman and branch. And I think we don't have any reason. We are the most populated in hospital setting, nursing. So we don't, if we are divided, we are in trouble. Don't allow other people to use you as an scapegoat. No. Be free and say what is right and do what is right. May Allah help us.
Thank you once again. The volunteer to give us the closing prayers, please.